She signed here. This is for the third one. There's nothing on it. Put it to the side. Nothing on it. Nothing on it. Not open. Nothing on it. All right. Emphysema. What does COPD stand for? It stands for chronic obstructive pulmonary disease. Is emphysema a form of chronic obstructive pulmonary disease? Yes, it is. What effect does emphysema have on the lungs? It destroys the alveoli and constricts the bronchioles. What is the leading cause of emphysema? Smoking. What are common symptoms of patients who have emphysema? Shortness of breath, cough, limit tolerance to exercise. What drug would you want to administer to a patient who is having an attack from emphysema, and why? You want to give them a bronchodilator because it'll dilate their bronchioles. What is the maximum amount of oxygen? 2 to 4 liters per minute. What stimulates the reflex to breathe? Low oxygen levels. What are the 4 things that your classmate's going to get? Emergency clipboard, emergency kit, AED, oxygen. What position should a patient who is having an attack be placed in? You want them upright. It'll make it easier to breathe. What types of vaccinations do you want them to have? You're going to want them to have influenza and pneumonia. I'm not reading these questions out. I've read them out too many times. How often should you take vitals? At least every 5 minutes. How many cigarettes? None. No one should be smoking. It's a choice. Where should you document everything? Do you want to document them everything on regular treatment or medical emergency report form? If your patient has an emergency, where should you remain? With the patient until resolved, or until the EMS arrive? And what's the number one thing you can do to prevent an emergency? Good medical history. We're going to ask that 5 more times, okay? What is the... Oh. Can I just go in order? I'm sorry. This is killing me. I'm going in order. I'm not gonna lie. I can go out of order. You want me to go out of order? We'll start at the back. Allergic reactions. I just can't stand these cards. What is an allergic reaction? It's an immune response to a foreign object. Which type of allergic reaction occurs? Usually within a few minutes. Type 1. Which antibody is involved? An IgE. Does an allergic reaction occur the first time? No, it doesn't. What effect does histamine have on the bronchioles and the blood vessels? The blood vessels dilate. The bronchioles constrict. How does histamine cause edema and difficulty breathing? Histamine causes the blood vessels to dilate. Dilate leaks fluid, or the blood vessels leak fluid. That causes swelling, which is edema. Swelling in the throat and tongue will cause difficulty breathing. If your patient tells you their tongue is beginning to swell, they're itchy, what type of allergic reaction they have? Type 1. What is the first drug you should administer? EpiPen. What are the 4 things your classmates should get? Emergency kit, emergency clipboard, AED, oxygen. You have given your patient EpiPen, they're still struggling. What do? You give them 50 milliliters of Benadryl. Is the type 4 allergic reaction the result of a cell-mediated immune response or a humoral immune response? It's a cell-mediated. How often should you take vitals? At least every 5 minutes. What is the number 1 cell involved in type 4? T cell. What do mast cells release? I say these wrong. Okay. Cholinase, protease, lysosomes, prostaglandins, and cytokines. What medicines could you give to a patient who is having a type 4 allergic reaction? You want to give 2 to 4 teaspoons of liquid Benadryl, or you can give them 25 milligrams of Benadryl, and that'll be 4 to 6 hours. Where should you document everything? On the record of treatment, an emergency report form. If your patient has an emergency, where should you remain with the patient until the emergency is completely resolved or EMS arrive? What is the number one thing you can do? Take a good medical history. What is the most effective drug? Epinephrine. A most effective drug for, what is it called? Allergic reactions. Epinephrine. Diabetes. Where is insulin produced and what is its function? It's produced in the pancreas, and its function is to give energy to the muscles and the tissue. What is glycogen? It's excess glucose that's being stored. Why is it important that glucose be constantly provided to the cells of the brain? Because glucose is the only way cells get energy in the brain. Which type of diabetic requires injections? Type 1 or type 2? Type 1. How do type 2 diabetics manage their disease on a daily basis? Through diet. What's the percentage for each type 1 and type 2? 15 for type 1, 85 for type 2. What causes gestational diabetes, and during which trimester does it occur? It's produced by the placenta. It's hormones produced by the placenta, and it's through the second and third trimester. What is hypoglycemia, and what are the symptoms of this condition? It's not enough glucose in the blood, and the symptoms are hunger, sweat, jittery, nervousness, excess salivation. What would you give to someone who is hypoglycemic? You want to give them sugar or something sweet. What is hyperglycemic? It is too much glucose in the blood. What are the symptoms? Thirst, dry mouth, dry skin, frequent urination. If your patient were conscious and hyperglycemic, what would you suggest them? Take your dang insulin. How often should you take vitals? At least every 5 minutes. If your patient is having a diabetic emergency and you don't know which one they are, how would you treat them? You're going to give them sugar because it's better to give them sugar than not. Which patient would be better be treated by glucagon? You want to give it to a hypoglycemic because they don't have enough sugar, and glucagon is stored glucose. You notice that your diabetic patient has a sweet, fruity smell that is hyperglycemic. Where should you document everything? Record of treatment and the medical emergency form. If your patient has an emergency, where should you remain with the patient until it's resolved or until EMS arrive? What are the questions you ask your diabetic patient before treating them? Did you check your sugar level? When did you check it? What was it? Did you eat today? Make sure you're okay, bud. And what did I miss? Seizures. What is happening inside the brain? It's a sudden discharge of electrical energy. What is the most common type of epileptic? It's going to be the grand mal. The first phase is your personality changes and you have an aura. Your second phase, you're going to lose consciousness. You're going to fall. You're going to have a little scream. It's the air releasing from your lungs. Your body might go rigid. You're going to start jerking. You can foam from the mouth. The third phase, you're going to wake up. You're not going to know anything because you're confused. You don't remember anything happening. A petite mal seizure is different. You are conscious, but you just lose awareness. You have a blank stare. You're just kind of staring off. Why is a status epilepticus seizure so dangerous? Because it's constant seizures back to back or very long seizures, and that can cause death. What is the first thing you should do? Call code blue. What are the 4 things you should send your classmate? Emergency kit, emergency clipboard, AED, oxygen. Your patient is having a grand mal. What position should you have him in? Up, supine. Why is it important to know the toxic limit for local anesthetic lidocaine? Because it can cause seizures. How often do you take vitals? At least every 5 minutes. If your patient is having a seizure that has lasted for 8 minutes, should you call 911? Yeah, because they could be having a status epilepticus and they could end up dying. What is the most important thing we can do to help a patient having a seizure? Move things away from them so they don't hit their head and they don't grab anything and put themselves in danger. Name 3 drugs that are commonly used to prevent seizures. Keppra. I'm using the street names. Car Patrol, and Dylan Trend. I probably said that one wrong. I don't know. Where should you document everything that occurs? You want to document things on the record of treatment, the medical emergency form. If your patient is having an emergency, where should you remain with the patient until it's resolved or until EMS arrive? And the number one thing you can do to help prevent emergencies is to take a good medical history. I'm so tired of doing these.